My question is the same as Deputy Bajic, and the Irish Nurses Midwives Organisation is holding its annual conference today, and a survey by nurses and midwives found that 65% of them nurses and midwives felt that patient safety was at risk and not conducive to the workplace. Now, something very important you as a government can do is in relation to the safe staffing framework. That should be implemented and should be underpinned by legislation. Underpinning that by legislation would make it conducive not only for healthcare professionals but also patients in a safe environment for their health.
Thanks, Deputy. I acknowledge that it is the case that patient safety is put at risk at times in our health service, and it's never possible to eliminate all patient safety risk, but we do try to reduce it to the lowest level possible, and we have increased the number of staff in our health service very considerably. 6,000 more doctors, nurses and midwives working in our health service than was the case 3 years ago, and we're implementing bit by bit the safe staffing mix, which I think is really important. I don't think putting it in legislation, though, would make it any easier. Ultimately, it's a case of being able to find adequate numbers of suitably trained staff in an economy that's at full employment in a very competitive global market, and putting that into law doesn't make that any easier or change it, unfortunately.